Mandate Secretary of the FCT Health Secretariat, Dr. Dolapo Fasawe, has allayed concerns over the report of a suspected outbreak of Ebola disease in the FCT. Addressing the press in Abuja, the Mandate Secretary stressed that the FCT is free of Ebola disease, confirming that a suspected case of Ebola virus disease in the FCT tested negative for both Ebola and Marburg diseases, effectively allaying public fears and unverified rumors.
Being very active in surveillance, having all the tools and the necessary government supports we need for us to pick up one suspected case is commendable, and for this I thank the Minister for supporting the health systems. It has been said many times that health is not being looked at. Behind the scenes, health is being looked at. If health was being ignored, we would not be here talking about Ebola today. I also want to make it clear that this is not the first case or the first suspected case we have had this year, but due to an effective and efficient surveillance system put in by the administration of Barrister Yelson Wiki, we have been able to follow the protocols like every other state, even doing better than every other state. For example, in the case of diphtheria. Diphtheria is a disease of consequence that is highly contagious and can wipe out children in no time. In 2023-24, we had an outbreak here, but due to the effective surveillance, monitoring, and treatment systems that have been put in the health sector, we were able, the first state, to nip it in the bud, and we clipped it, stopped it, and up till today, we have not seen any diphtheria case. Health is working. Health is not only infrastructure. Health systems are being strengthened. After all that being said, I want to say that diseases don't respect states, nationality, or religion.
The Secretary clarified that the suspected case involved an individual identified as patient X in the FCT for reasons of confidentiality who had a travel history from Rwanda, which borders the Democratic Republic of Congo, where Ebola has been confirmed.
Diseases also don't respect borders. What has happened is that in Congo, there's not suspected. Ebola has been confirmed in Congo. Ebola is a disease of high consequence. When I say high consequence, it means that 1, it's highly transmissible. 2, it kills very fast. Within 24 to 48 hours of being infectious, if you do not get the right treatment, you're gone. 3, there's a likelihood of community transmission, meaning that contact tracing becomes impossible. Whole communities are getting it. But due to our operating protocols that has been put in place by the Honorable Minister, we have been able to curtail, not only curtail, have high index of suspicion, and we picked up patient X for confidentiality reasons. And I hereby officially announce that she is negative for Ebola and negative for Marburg disease. These are viral hemorrhagic fevers that can lead to death and can affect all of us here in less than 24 hours. It has been curtailed. It is negative. It is a peculiar place. We have an air border. Diseases come into countries through diseases like this. We all remember Corona through different borders: the land, the sea, and air. We are working closely with NCDC to ensure that all borders are secured, especially FCT, where we sit in.
Additionally, the Secretary provided an update on the FCT Minister's recent approval for the payment of health workers' allowances and the employment of new doctors. She said that 37 doctors have already been employed, with plans to hire close to 300 more healthcare professionals in the shortest possible time.
thing about the minister's approval is we will not have to have this agitation again. For us not to have this agitation again, for his approvals to be sustainable, we need time for administrative purposes. I cannot give you a definite time, but I can tell you, for example, the low-hanging fruits, like employing more doctors, is already in effect. He has given a large number. Out of this large number, as of today, 33% of that number of doctors to be employed. In fact, as a matter of fact, 27 doctors have been employed, and we're in the process of employing close to 300 healthcare workers. These are low-hanging fruits. Employment does not lead to salary on the next day. So there are processes, and in the shortest possible time, this is a priority to the minister. Every allowances due will be paid, and so that we do not come back to this agitation again next year, we have to put in place sustainable systems that these people are paid automatically.